Hi, Joe Alton, MD here, also known as Dr. Bones of the survival website doomandbloom.net, where you'll find over 1,200 articles, podcasts, and videos on medical preparedness. Plus, a co-author of the best-selling 4th edition of the Survival Medicine Handbook and designer of an entire line of medical kits specifically made for the off-grid medic. Recently, I discussed off-grid strategies for nosebleeds, both minor and major. Bleeding is often spontaneous, but can also be related to trauma. Trauma to the nose can result not only in bleeding, but in damage to the bone or cartilage. Indeed, a broken nose is the most common fracture of the face. If there is a nasal fracture, the patient will experience significant swelling and pain. Any pressure on the nose is going to be seriously uncomfortable. Bleeding occurs in varying amounts depending on the nature of the fracture itself, and blood collection in the nasal cavity can block breathing and result even in abscesses, collections of pus, or scarring. Diagnosis is fairly straightforward. When examining the patient, you're going to notice maybe a crunching sensation when you touch the injured area. Very painful, by the way. Bruising beneath the eyes, that's pretty common. And of course, like I said, very, very painful. A nasal fracture can cause permanent deformity and difficulty breathing from a damaged septum, the wall that separates the nostrils. If there's no major issue with breathing, however, it's usually a cosmetic problem. An instrument called the nasal speculum, that's this, can allow you to inspect each nostril for blood clots and other abnormalities. Early treatment for a broken nose places emphasis on decreasing pain, bleeding, and swelling. Apply cold packs over the nose for periods of 20 minutes off and on during the day. This will be useful only for maybe the first 48 hours, but it's going to help reduce swelling and discomfort. A packing may be helpful if bleeding is an issue, so this is something that you may want to do. Use a bayonet forceps and some packing gauze rolls. This can also be improved with a nasal decongestant once the packing is removed. It should be noted that deformations caused by a nasal fracture are not going to straighten out by themselves, so the family medic may sometimes choose to intervene in survival settings. If this is the course of action, it should be performed in 3 days or so after the actual injury, after swelling has subsided. This should not be attempted, however, after 2 weeks have passed because healing is too far along. The goal of reducing the deformity is to realign cartilage and bone to their original positions, to decrease discomfort and maximize airflow. Be aware that this type of manipulation can cause further damage. Shouldn't be done if modern medical care is available. Physicians use special instruments like nasal elevators and others to manipulate, pack, and cast the nose into its original shape. Many of these items are unlikely to be in your medical kit. Nurse Amy, by the way, has a pretty good nasal kit in her store. If modern medical care is not an option and you choose to intervene, the procedure goes as follows. Sit the patient down. The pain associated with the procedure may actually cause them to become lightheaded. Have them blow their nose once to eject blood and mucus. Make a triangle with your hands, placing 4 finger pads of one hand against 4 finger pads of another. Place the apex of the triangle snugly at the top of the nose. Have the patient take a deep breath, then bring your palms together until they are molded firmly against the nose, and then slowly drag your hands straight down towards the chin. If you are successful in reducing the deformity, you should then consider placing some moist gauze packing and taping the nose in position. The packing should not be removed for 2 or 3 days. Another option is the Thermoplastic Splint that Nurse Amy has in her kit, which is activated in very warm water and then molded around the nose where it hardens and provides protection. It can be placed on the nose with or without tape. Elasticon is an option for stabilization. The splint helps reduce swelling and dead space during the healing process and protects against further injury. Here's how to use this nasal splint. Activate it by placing in water heated to about 70-75 degrees Celsius, that's 160 degrees Fahrenheit, for about 3 to 5 minutes. After it's activated, the splint becomes soft and pliable. At this point, remove it from the water and dry it with a soft cloth. Remove the glue layer, place it on the nose, and you push it gently into position. Within 3 minutes, it becomes rigid and fixed. Note, don't put the nasal splint in hot water more than 175 degrees Fahrenheit, 80 degrees Celsius. It causes it to deform. Also, don't allow the nasal splint to remain in water for more than 10 minutes total. Store this at room temperature, by the way, if you are going to have a supply of this. It should be noted that a traumatic event hard enough to fracture the nose can also cause injury to the neck. Careful attention should be given to possible cervical spine damage. Stabilization with a neck collar may be an appropriate strategy. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for watching. Hey, did you know that our brand new, greatly expanded 4th edition of the Survival Medicine Handbook covers just about every issue faced by the family medic in off-grid settings? Check it out at store.doomandbloom.net. And fill those holes in your medical supplies with quality kits and individual items from our entire line at store.doomandbloom.net. You'll be glad you did.